Hello, this is KEJC, or Kentucky Equal Justice Center's presentation on health coverage and food assistance in Kentucky for the Kentucky Immigrant and Refugee Inclusion Summit in 2021. My name is Miranda Brown. I am KEJC's Outreach Coordinator.
And hey, I'm Tyler Offerman, KEJC's Food Justice Fellow.
So welcome to our presentation on health coverage and food assistance. I'm going to share our slides. Okay, so Kentucky Equal Justice Center is a nonprofit. Our mission is to promote equal justice for all residents of the Commonwealth by serving as an advocate for low-income and other vulnerable members of society. So we work closely with the legal aid organizations, but we don't have the same restrictions that they have due to their funding. And so we can file class action lawsuits, do more lobbying, and represent people who are undocumented. We serve through advocacy, legislative, policy, and administrative advocacy, through direct legal services and litigation in specialized areas such as immigration and wage theft and impact litigation. And we also offer Know Your Rights outreach and community education. So our staff have submitted another presentation to this virtual conference covering workers' rights. And in that presentation, you can find up-to-date information on wage and hour law, health and safety in the workplace, and unemployment and pandemic unemployment assistance. But for this presentation, we'll be focusing on health coverage and food assistance. So take it away, Tyler.
Great, thanks, Miranda. I was also just wondering if you can do a full screen share. I can still see the options bar on the top. There it is. Wonderful, cool. Thank you so much, Miranda. So I am going to touch base on three main federal food and nutrition programs. You may have heard of some, you may have not. I'm not gonna be able to do a super deep dive into each, but if you have any follow-up questions, we'll have contact information at the end, and always look forward to talking with you if you wanna reach out and ask any other questions. So first program that we're going to talk about is SNAP, the Supplemental Nutrition Assistance Program, formerly known as food stamps. Program is meant to help folks struggling with poverty or job insecurity to be able to meet basic nutrition needs. And many folks have heard of this program. It's probably the most well-known of the federal feeding programs. We'll talk a little bit more about eligibility and such here in a second, but just a couple updates as far as pandemic specific. So each of the programs we're going to talk about today have had changes because of the pandemic. Some are permanent, some are time limited. But a couple for SNAP in particular is that there was a 15% increase to the maximum benefit that'll run through June of 2021. The emergency SNAP benefits, also called max allotments, which allows anyone on SNAP to be taken to the full amount. Normally it ranges between 20 to 200 and some odd dollars per individual. So if you qualify for SNAP during the pandemic, you get the max no matter what. And currently that's $234 for an individual. That program will last until there's an end to both, or to either the federal state of emergency or the state's state of emergency. Currently both are in effect, so the emergency allotments will continue until either ends. Miranda's going to talk about this more later, but public charge has ended. Big celebration. If I had a clapping recording, I would use it now. So I won't go into that here, but just wanted you to know it no longer has any effect for anyone in SNAP. So another quick change is that low-income college students can now qualify for SNAP. There used to be onerous work reporting requirements, and those are not in effect for this year and next year, but they are not permanent. They will go away. So folks can take advantage of that now, though. Go to the next slide. Great, just a couple quick considerations for eligibility for citizenship and immigration status. All US citizens and some legal residents can receive SNAP benefits, and non-citizen parents can and should apply for benefits for their citizen children. As far as income, every state's different, but in Kentucky, we do 200% of the poverty line for the gross income, 100% for the net income. You can see the actual monetary amounts broken out there. I just used two examples, an individual example and a family of four. It's different depending on the household size, 1 to 8. And then there is an asset test in SNAP law. You or your clients might be asked about this. You should report any assets, but in Kentucky, we don't apply the asset test. So make sure to report assets, but know that they shouldn't count against your clients. And then lastly, just have, what counts as income. There is more detailed information. Obviously, there are some forms of income that are a little bit more obscure, but one quick thing I did want to say here, Miranda did a shout out for the workers' rights presentation that KEJC put forth. There's a number of unemployment insurance programs that were created in response to the pandemic. Some count as income for SNAP, but some do not. The one that does not is called the Federal Pandemic Unemployment Compensation. That's the $300 that is added in addition to your other UI benefits. It's the amount that's added on top. That amount, that $300, does not count as income in SNAP. So that's really important to know. Go to the next slide. Great. Just a couple quick points as far as client rights in SNAP. I won't read through them all, word for word, but DCBS workers should not be sending any information to ICE or immigration enforcement officials. Folks have the right to interpretation and communications in their preferred language. It says on the application, what is your preferred language. The cabinet is duty bound to then follow that. So if you have any problems, make sure to file a complaint or find a resolution to that. And then I made the point earlier about non-citizen parents being able to apply for their citizen children. Just know that not everyone in the household has to apply for SNAP. So there might be a number of people within the household. You have to report the income for the household, but just because someone resides there, that does not mean that they have to be applying for SNAP. So there are a number of rights and protections in SNAP. It's probably there's some pretty robust protection. So just know if you have any problems or if any of these things do not come out to be true for you or your clients, you should reach out to me or Miranda or someone at KEJC immediately. We'd be very interested to look into that for you. Go to the next slide. Great. So second program, WIC, Women, Infant, and Children program, similar to SNAP. This provides nutrition benefits, allows folks to go to grocery stores and buy food. However, unlike SNAP, WIC also includes some healthcare pieces and provisions because it's meant to support either pregnant, breastfeeding mothers or caretakers of young children. So a couple recent changes due to the pandemic. Oftentimes you have to go down to the health department, which is where you would enroll and participate in WIC. You have to go and do health screenings or, provide medical documentation. It used to be a very in-person heavy program because of the pandemic and how you can't be doing that, y'all, as Governor Beshear would say. A lot of those have been waived. And we expect them to be waived as long as there's a state of emergency. So next slide. Great. So Couple things I mentioned earlier, that you don't necessarily have to be a woman, infant, or child to apply for WIC, which is a little confusing because that's what the name is. But fathers, grandparents, caretakers of children under 5 years old can also apply for WIC. Income threshold is a little bit different than SNAP. It's 185% of the poverty line. And as you can see, there are also what we call adjunctive eligibility. So if your clients qualify for some of these other programs, then they might adjunctively qualify for WIC. You need to be a resident of Kentucky, but you do not need to provide citizenship status. So WIC, unlike SNAP, is more open and more available to undocumented and mixed status families. So go to the next slide. Great. Last program I'm going to talk about is Pandemic EBT, which stands for Electronic Benefits Transfer. That is the very catchy name for the card that benefits are loaded onto. So this program was created specifically in response to the pandemic. It is meant to replace meals that children missed at school who were enrolled in the National School Lunch Program. It's a little bit of a mouthful, but it's important because if your child was not enrolled in the National School Lunch Program, then they would not be eligible for P-EBT. There's a couple ways for your child or for your client's child to participate in this program. In that either your school has community eligibility, which means there's enough children on free and reduced in the school that everyone is eligible, or you or your client would individually apply for participation in the National School Lunch Program. And you can do that through your school or school district. Here's a picture of what the P-EBT card looks like, just for reference. You can go to the next slide. Great. So as I mentioned, participation in the National School Lunch Program, sometimes called free and reduced lunch, is required to participate in P-EBT. Basically, the way that it works is as long as your kid is in the program or your client's kid, I keep saying that, sorry. Normally I present to parents on this subject. You get that P-EBT card, that white card. There have been multiple rounds of P-EBT since the pandemic started. I believe technically we're in round 4. So you or the folks you work with might be confused about how is this current round different than the previous rounds. The biggest difference now is that the cabinet is not proactively sending out new cards to people. So folks who have cards from the immediate previous round, the October-September round, those cards would be reloaded with new benefits. If you or your client was on SNAP, then they would just be loaded directly onto the SNAP EBT card instead of the P-EBT card. The current round, the monetary amounts that we're looking at. So if your or your child or your client's child was fully virtual for the month through October to February, they would get that amount, $136.40. If they were hybrid, which meant, half and half or some mixture of in-person and remote, they would get $81.84. For March through May, since this when they started this program, they actually communicate with the school districts to see how many days is the child in the school, and then it's $682 per day. An exciting announcement that I don't have the full details to tell you now, but the American Rescue Plan, which passed in January, created a summer EBT program, which basically just allows P-EBT to be extended through the summer. So Kentucky will also be issuing benefits through this similar process onto the P-EBT cards or the SNAP card for SNAP clients for June, July, and August. So keep an eye out for KEJC's social media feed, and we'll be sure to update you as we get new information. Next slide. Cool. Last thing on P-EBT is just because the way the reporting goes, right? So the school districts report to the Department of Education. The Department of Education then takes all that data and sent it to the cabinet. The cabinet sent all that data to the people that produce the cards, and then that is how it's supposed to get to you. You can imagine with each step along the way, there might be some confusions or mistakes, reporting mess ups. There's plenty of parents who have not gotten the amount that they thought that they should. Maybe their child was full NTI, but the school was half-time. Maybe their child had special food needs, so or was immunocompromised. So even though the school went back full-time, their child didn't. There's a number of reasons. There's a process to get a reconsideration. You call this number, provide this information, say how much was received and how much should have been received. And if you have any problems, I recommend also, if you can't get it resolved through the cabinet, then I recommend you reaching out to your school or school district, the nutrition director, and trying to see if it's not a data problem on the Department of Education side. I laid down that sort of convoluted chain of events because, like I said, maybe the Department of Education just sent the wrong number, the wrong data to the cabinet for your child or for that school. So might be frustrating to get an answer. Hopefully it's not. Some people get through easy breezy. If you have any problems, reach out. Couple important phone numbers there, just depending on what situation you're in. And there is a frequently asked question on the cabinet's website. So I think that's all that I got, and I'll hand it over to Miranda.
Okay, now that I'm unmuted. Thanks, Tyler. So to transition between food benefits to what I'm going to talk about is health coverage, I've got a screenshot here of connect.ky.gov. This is the Kentucky website for applying for either of those programs, including food assistance, which is SNAP, or the food stamps, Medicaid, child care assistance, and KTAP, financial assistance for children and caregivers, and Medicaid. So you can use this website to apply for any of those things. And a few points as we get started with healthcare and health coverage. Know your rights. You cannot be, and your clients cannot be, denied health insurance because of a pre-existing medical condition. That's part of the Affordable Care Act. And all health insurance plans have to cover a set of minimum essential benefits, which include mental and behavioral health. Also, COVID-19 testing and vaccination is covered by your health insurance at no cost to you. And if you don't have health insurance, it should also be free. So if you or your clients receive a bill for COVID-19 test or vaccine, you can appeal that charge through the insurance carrier. And our link here on the slide and in our notes will be a link to our blog on our kyequaljustice.org website for detailed help on how to appeal a charge like that. So during the state of emergency right now, the easiest way for someone who lives in Kentucky and has no health insurance, the easiest way for them to get health insurance is by filling out the Presumptive Eligibility application. Now, Presumptive Eligibility, or PE, is a temporary form of Medicaid. So it's free health coverage. During this time, still in Kentucky, more people are qualified for PE. More community partners are certified to help people enroll than before the pandemic, and no documentation is required. You don't have to prove your income. You don't have to submit pay stubs and wait for them to be approved. It's a one-page application, so it's very quick. And it's free. It lasts up to 3 months, and an individual can have PE Medicaid twice in 1 calendar year. So if you do the math real quick, you'll think that, it's true, you will realize that anyone who had PE Medicaid as of January 1st, 2021, they had it for 3 months, and then they could have gotten it again for another 3 months, but that will be twice in 1 year, and so their PE Medicaid will be ending on June 30th, unless something were to change, but currently that's what the case. So anyone who is uninsured or under the Medicaid income limits, which I'll talk about in a minute, or under age 65, all those and under age 65 could qualify for PE Medicaid. And one of the ways to apply is through connect.ky.gov that I just showed a screenshot of. And another way would be by calling this phone number. And another way would be by getting the help of a connector or an application assister, which I'll talk more about in a moment. So again, here's a screenshot of Connect, just to show you the specific place that you would click on. Again, the website's connect.ky.gov, and you would scroll to the bottom and click COVID-19 time limited coverage to find this application for PE Medicaid, which is one page of entering in number of people in your household and amount of your income, which again, they don't require documentation of. You can see here that it asks if you have a social security number. If you put no, you are allowed to complete your application. And I will say many people without social security numbers currently have PE Medicaid. So if you have PE Medicaid, that's going to end, or if you had regular Medicaid at the beginning of the pandemic, non-PE, just were eligible for Medicaid already, then no one on regular Medicaid is losing their benefits right now unless they disenroll at their own request or move out of the state. Kentucky has extended Medicaid renewal dates during the state of emergency. And so nobody's renewing yet. And we don't know yet when people will start having to renew their Medicaid again. But if they had Medicaid at the beginning of the pandemic, chances are they still have Medicaid. And there are no more Medicaid copays. That is true during the pandemic, but also because of new legislation that's in the process of being implemented, will be true going forward. And there are many prior authorizations for care under Medicaid have been suspended. So here are some examples of the annual income limits for Medicaid, PE Medicaid, and KCHIP. And Medicaid and PE Medicaid are free health coverage for children and adults. KCHIP is similar, but it covers children only, no adults, but KCHIP goes up to a higher income level. So you can see here just some examples, and I put annual amounts on this slide, but it's important to note that these programs are actually based on your monthly income. And so if your income is above these limits at the beginning of the year, but say in September, you lost your job and the remainder of the year had no income, then you would be eligible for Medicaid or KCHIP for the remainder of the year, even if your total income for the year is above the limit. So this slide shows a screenshot of healthcare.gov. Now this is the marketplace. It is a way for people who don't have health insurance and don't qualify for Medicaid to enroll in private health insurance, but at the same time as they do that, they can also apply for tax credits to reduce the premium that they pay, to reduce their monthly cost for health insurance, and also for reductions in their out-of-pocket expenses like copays and deductibles. Now, usually people have marketplace coverage or healthcare.gov coverage if they are under age 65, their income is above the Medicaid limit, and they don't have a health plan through their employer. So if you or a client has marketplace health insurance, you may be able to change to a lower cost marketplace plan right now due to the American Rescue Plan Act. And if you don't have marketplace coverage but need to enroll in it, maybe because your presumptive eligibility or PE Medicaid is ending soon, this will be relevant information for you. So you can report an income change if you already have a marketplace application by calling this federal number or the state number, as the two numbers listed there, or you can go on healthcare.gov, go into your application and change it that way, or again with the help of a connector. And this website is available in Spanish as well, cuidadosdesalud.gov. So the American Rescue Plan, which was recently implemented, includes financial help to lower the cost of marketplace health insurance, and many Kentuckians are already seeing large savings on their monthly premiums through the marketplace. I took this chart from the Kentucky Health Benefit Exchange. It shows you some examples of households on the left what their income limit, or not limits, but what some examples of what their incomes might be for those households in the second column. And then in the middle there, it shows what their premiums would have been for a benchmark plan on the marketplace before the American Rescue Plan. And the following column shows what the premiums for the benchmark plans are now. And so in the final column, you can see the difference in how much these example families are saving. According to the Kentucky Center for Economic Policy, more than 122,000 Kentuckians are now eligible for new or enhanced subsidies on the marketplace or tax credits. And 7,100 Kentuckians are newly eligible for even a zero premium marketplace benchmark plan on healthcare.gov. So I mentioned who might be getting on healthcare.gov or the marketplace for health coverage. Now let's think about who additional eligibility requirements. If somebody, I mentioned PE Medicaid is for anybody regardless of immigration status or social security number. Marketplace is slightly more restricted. Citizens and anybody who's lawfully present for the duration of the insurance plan. And marketplace health coverage is based on calendar year, so that's until December 31st, 2021. All of these folks can get marketplace coverage, which is more strict than PE Medicaid, but less strict than regular Medicaid. So when can you enroll? Generally, the open enrollment period is November and December, but importantly, this year, the Biden administration has opened a special enrollment period for everyone through August 15th. So your circumstances do not matter. You could have had one of these general special enrollment reasons, like losing other coverage like Medicaid or PE Medicaid or employer coverage. These are just some examples of common reasons to be eligible for a special enrollment period outside of open enrollment, but not even relevant until after August 15th because everyone can enroll right now. Or if you already have a marketplace plan, you can go into your application on the phone or online and change your marketplace plan or change the amount of tax credit if you're eligible to. That's applied to your marketplace plan. So I've mentioned several times how in any of these applications you can get the help of a connector. If you don't want to do it on your own, or if you've tried it on your own and had trouble, then I would recommend getting a free connector or an application assister who can help you apply or troubleshoot your application if you've already applied. So this is for Marketplace or Medicaid or PE Medicaid or KCHIP. Here's a quick website where you can go to find a marketplace, or find a connector or an insurance agent. You can call this number to get referred to a connector or insurance agent. And then again, if you've been denied Medicaid or cost savings on healthcare.gov, maybe try contacting a connector to see if you've done everything correctly or if the results are accurate. And then if you actually need to appeal, I would recommend contacting your local legal aid program. And at this link, kyjustice.org, you can find links to and information about Kentucky's civil legal aid providers. So again, here's a screenshot of that Connect homepage. And again, at the bottom, there's a link to find connectors to guide you to the right plan. So that's just one other way that you can online find a connector. So the eligibility, of course, is different for Medicaid versus PE versus Marketplace, but generally outside of PE, the folks that are excluded from regular Medicaid, KCHIP, and Marketplace are going to be people who are undocumented and people who have DACA, which is not considered really an immigration status for these purposes of these programs. So what can these folks do? You all may be familiar with community health centers and health clinics in your area, federally qualified health centers. You also may be familiar with retail clinics, that's pharmacies or Kroger. Some immigrants who are undocumented, or at least people who have DACA, have an employer. DACA recipients have work permits, and so they can get a job, and that job might offer health coverage. So that's an important option not to forget. And then again, PE Medicaid is for any of these folks who are within the income guidelines and age restrictions. and don't have other health coverage. So PE is still an option. And then on the next few slides, I want to go into more detail about emergency Medicaid, DISH, and DISH. But then the last 3 bullet points here are disease-specific programs like for cancer or diabetes, and prescription assistance programs. And one really good resource to go for searching for the right disease-specific program or prescription program or crowdfunding or whatever it is for your medical needs is needymeds.org. So to touch on presumptive eligibility Medicaid again, right now it's helping uninsured people during the state of emergency. But even outside of the pandemic, presumptive eligibility Medicaid has been used to help pregnant women who qualify for Medicaid in every other way but their immigration status. So generally a medical provider would help the woman apply. It only covers 2 months of the pregnancy. So hopefully she's able to go to a health center that's able to continue care after those 2 months. And then it matters when you apply, because if you apply at the end of the month, it'll only cover the remainder of the month in which you apply and the following month. So if you apply at the beginning of the month, it will cover more of those expenses. Now, emergency time limited Medicaid is really important right now. You may have heard it called emergency Medicaid or time limited Medicaid, but so that we don't confuse it at all with PE, I like to use the full name, Emergency Time Limited Medicaid. So this is for people who qualify for Medicaid in every other way but their immigration status. It covers doctor's bills, hospital bills, whatever, but only to care for an emergency. Importantly, it does cover COVID testing, evaluation, and treatment because COVID-19 is considered an emergency. It also covers childbirth, but does not cover organ transplants. You can use emergency time limited Medicaid for 2 months at a time, but sometimes it can be renewed if your emergency condition is ongoing. And patients can apply at the hospital when they have an emergency with DCBS or with the help of a connector. And it's important to apply within 3 months of your emergency care because after that you're not able to enroll. So next is DISH. So this stands for Disproportionate Share Hospital Program. It helps Kentucky hospitals that care for many low-income people. It is a pool of money to help cover hospitals' cost. It helps people who don't qualify for Medicaid or KCHIP, but who are Kentucky residents. And it only covers the hospital bills. So hospitals might be screening people for DISH. Their forms might say DSH on them, or they might screen people just for their own financial assistance or charity care programs, which are likely in part funded by DISH. So just as we wrap up here, I want to make sure that folks know your rights. Mixed status families, similar to what Tyler was saying about food assistance, mixed status families where maybe some members of the family have citizenship or permanent residence and some are undocumented or have DACA, for instance, they can apply for Medicaid, PE, KCHIP, healthcare.gov for the eligible family members. Government agencies cannot ask about citizenship or immigration status of anyone in the family except those that are applying for coverage. It's part of the application, but it's not required to answer that information if they're not applying for coverage. And states cannot deny benefits to an applicant just because a family member does not have legal status. So providing your social security number is voluntary. Agencies, of course, may ask for a social security number of people listed in the household who are not applying. However, those non-applicants do not have to provide a social, and their family members cannot be denied coverage because their other family member didn't provide the social. Importantly, too, Medicaid offices and call centers, because they are federally funded, are required by Title VI of the Federal Civil Rights Act to provide assistance in their client's preferred language. So are any medical providers who accept Medicaid because it is federal funding. So if a patient asks for an interpreter, these offices are required to provide one, if not in person, then over the phone or video. And generally, if they request written documents in Spanish, those are also provided. So when you apply for Medicaid or KCHIP or healthcare.gov, all of the information that you submit is necessary to determine your eligibility. It is only used for that purpose. ICE, which is Immigration and Customs Enforcement, assures that they do not use healthcare application information for immigration law enforcement, like deportation. I also want to cover public charge briefly, and the only reason I include this is because it's been a big question for the last couple of years, though in actuality it's not really even relevant, but just to clear up any confusion, in immigration law, public charge refers to a person who is likely to become dependent on the government for support. Public charge is assessed by U.S. Citizenship and Immigration Services when a person applies to enter the United States or applies to become a lawful permanent resident, which is that they're applying for a green card. The only two types of public benefits that are considered for public charge are cash assistance for income maintenance or institutionalization for long-term care at government expense. And that cash assistance is just SSI or TANF, which in Kentucky you may know as KTAP. And on March 9th, 2021, the Biden administration reverted back to the pre-Trump rule. And that's where we were getting confusion. The Trump administration tried to add additional public benefits to this list and add some other restrictions. But this year, now as of March 9th, we are back to pre-Trump rule. And these are the only two types of public benefits that are considered. So what is important for immigrants to know about public charge? Well, first and foremost right now, COVID-19 testing, prevention, and treatment does not count against immigrants in a public charge test. 2, the only benefits which affect public charge are, like I said, cash benefits like SSI and KTAP, and long-term care institutionalization at government expense. 3, public charge is not considered for many immigration types anyway. And 4, every situation is unique. So if an immigrant is not sure if they're going to be subject to the public charge test or not, they should consult with an immigration attorney. And this is a link where we've got, where our partners at least have a list of all the immigration attorneys that have been vetted that you can go to for help. So if you want more information about public charge, Protecting Immigrant Families has great fact sheets in multiple languages and links to additional research and also ways to get involved in immigration policy. And then for an immigrant targeted guide about public charge in English, Spanish, and Chinese, you can go to keepyourbenefits.org. So on this slide here, we have just phone numbers and links to the different agencies that offer the types of assistance we've mentioned in this presentation, including the Department for Community-Based Services for Medicaid, KCHIP, SNAP, KTAP, child care assistance, and then for health coverage in general, whether it's Medicaid or Marketplace, and also to get referred to an application assister or connector, health insurance Marketplace, which you can do on your own or with the help of a connector. We've got information for WIC, Women, Infants, and Children, and then our own contact information at the end. So if you'd like to follow us for more information and updates, here are links to our website, our YouTube channel, our radio show and podcast, and our social media. So that concludes our presentation for the CHRIS, Kentucky Refugee and Immigrant Inclusion Summit, and our focus on health coverage and food assistance during, or in general, but also during the pandemic here in Kentucky. So thank you all for listening. Thanks, Tyler.